Hello and welcome back for another episode of the Noobie Dentist podcast. I'm your host, Dr. Omid Azami. In this week's episode, I had the pleasure of sitting down with Dr. Krati Garg. Dr. Krati Garg completed her dental training and specialty training in oral maxillofacial surgery in India prior to moving to Australia in 2007. She went on to become a fellow with the Royal College of Dental Surgeons in 2009 and is a consultant oral surgeon at the Royal Dental Hospital, where she is currently the OMFS Department Head. As if all this has not been impressive enough, she also completed her master's in journalism at the University of Melbourne and has published in reputable media outlets such as the Age and SPS News. In this episode, we chat about Dr. Krati's journey and the challenges and obstacles that she faced early in her training. And we also have an in-depth conversation about what she has learned from training so many residents in oral surgery over the years and the key traits of successful young clinicians that she's noticed. Next, we had a talk about COVID-19 and the impact it has had here in Australia, and in particular on the public dental system where we both work. And for context, this interview was recorded a couple weeks ago before Melbourne had its second wave of the virus, and a fresh set of restrictions have now been in place as we're seeing an increase in community transmission being spread throughout the city. We also finish off this episode talking about the importance of work-life balance, including the importance of developing hobbies outside of work. This episode is filled with a lot of great content, and I'm sure you guys will enjoy it. This week's episode is brought to you by my good friends at Ivoclar Vivident. Ivoclar is one of the world's leading and most innovative dental companies, offering a comprehensive range of products and systems that provide you with new opportunities in dentistry. For an even more aesthetic and efficient result and better dental care for your patients. Making people smile is what they do. To find out more about Ivoclar, their products, and the Ivoclar Academy, visit www.ivoclarvivident.com.au. And as always, if you're new to the Noobie Dentist, be sure to check out all the previous episodes. We've had a lot of great guests on the show. And if you do enjoy the podcast, if you're a longtime listener, be sure to pass this episode on to your friends, colleagues, or classmates. It does help the podcast grow. Without further ado, please enjoy this great interview with Dr. Krati Garg.
Welcome to the Noobie Dentist podcast, giving a voice to young clinicians worldwide. The Noobie Dentist podcast aims to be the dental industry leader in in-depth, informative and motivational interviews with some of the world's leading clinicians, academics and experts. With your host, Dr. Omid Azami.
So I'm here with Dr. Krati Garg, who is one of our bosses at the Royal Dental Hospital, where I've been working for the past few months as an oral surgery resident. Dr. Garg, I met you early on when I was in dental school, and I remember I was assisting for you in theater. And at the time, one of my good classmates, Dan Bedarami, who you know quite well as well, and I were quite keen on research. So I remember after the clinic session, the theater session finished, I came over and I was like, if there's any research projects, and you're kind enough to kind of help us out and get us going on that kind of road. And it's funny where you don't know where things are going to lead, because a few years later, I was kind of reaching out to you again and really interested in this position, and your help and support really means a lot to me and kind of getting me where I am now. So I just want to kind of publicly thank you, I guess, on the podcast before we get into it. Normally how we like to do things is just start with a bit of an introduction, a bit of a origin or backstory. And I know you have a pretty cool story. You've been through a lot in your career and traveling and things. So if you want to just take us back, sort of, I guess, why dentistry in the first place, and then the process of going through dentistry into oral surgery, and then your process of moving to Australia and getting your license and things here. That'd be awesome.
Sure. And thanks, Omid. And I don't think you've got anything to thank for, because I think people who are perseverant and hardworking and interested in things in general, I think they find a way regardless of what comes in their way, or people who help them or not. I think they always manage to be where they want to be eventually. So well done on coming back. And even as a student, I know there were a bunch of people in your batch who were really enthusiastic about the surgical part, and that's always a little bit of exciting thing for me when I see a student who takes a little bit more interest than the normal blood and flesh. And does their homework and and asks questions and is ready with stuff. So I think you guys were a couple of those students who really I think made my belief in teaching a bit more strong in terms of what we are doing is probably the right thing.
Yeah, for sure.
Yeah. In terms of dentistry, I don't think dentistry was ever my first choice and still isn't. I'm sorry to disappoint all the dentists out there. A class 2 silver amalgam or a composite filling still freaks me out. But I think the part of dentistry that really interested me early on in my career was surgery. And when I was in year 11, actually in year 11, we have to choose subjects. And my dad is a journalist, so journalism always interested me and storytelling and all those kind of things. But I was at that crossroads, and I don't know how much you're familiar with India and Asian countries. Especially in India, where the era where I grew up, there were only 2 mainstream professions which were considered as professions, medicine and engineering, and humanities and arts and economics and those kind of things were still very parallel and, not really, culminating into something constructive later on, job security and all of those kind of things. So my dad said that, well, you can always be a journalist even when you are older. Why don't you get a real job first? And this is coming from a person who was actually a journalist. So I thought, fine. And then the other thing that interested me at that point in time was neurosurgery. And I envisioned myself as a neurosurgeon somehow. So year 12, 11 went in sitting those medical entrance tests. And I think 8,000 kids, year 12 kids, sat those exams in my state, and there were 300 seats. So
it's so competitive.
Yeah. And it's an objective exam, and I think I missed out by 0.6% in the medical entrance. And I just thought, now nothing is left for me. So I was on a wait list for dentistry, and that's how things work in India. So it's medicine, dentistry, nursing, veterinary sciences, and so on and so forth. So dentistry came as a default, and I was like, what? I've never ever thought of becoming a dentist. And people were like, you're foolish if you turn it down. And I thought, okay, fine, let's give it a go. And I still remember my first year was pretty much a blur in the sense of I'd never thought of bending wires or fillings and all those kind of things. And I did quite well in my first year. I think partly because of the subjects like anatomy and physiology and those human biology kind of subjects, which I did really well in. And then second year, we had our first experience with a patient. I pulled out a tooth and I thought, that's it. This is what I want to do. And after that, I didn't focus on any other subject, really. Third year, fourth year, it was totally surgery focused. I did well overall, but I think surgery was my main go-to. And then again, we had to sit another entrance for maxillofacial surgery and another roadblock, which I had to take some time off after my dentistry, almost 6-7 months to study for the exams. And that was a bit challenging because almost 7,000-8,000 or even more kids, dentists sit across that common entrance test for peds, endo. So it's 50 seats. And out of that, there are, I think, 13 odd seats for maxillofacial. But this time I had decided that no matter what, I have to get in. And luckily I got in. I got 16th position in that entrance, I still remember. And I took up maxillofacial surgery, 3-4 years of intense training at one of the India's busiest hospitals. And then, since then, I've not looked back in terms of career, why surgery or, that question doesn't really come to my mind.
Yeah. So when, just if you can go back when you were doing the OMFS training in India, what was that like in the first couple of years? The growth, the learning curve of like getting exposure to these things, because obviously, from fast forward now, like from our position, seeing the more senior people, like the registrars and things going through, and their experiences. So it'd be interesting to see how you kind of see yourself in that position. What was it like in the first few years for you there?
Sure. I think I can say that things have changed dramatically since I trained in a lot of ways, but in some ways it's still same. And I was having this conversation a while back with one of our registrars as well, that surgery is still a very male-dominated specialty. So when I got in, I was the only female out of those 13 candidates to pick up max-fac surgery. So at that point in time, it didn't really matter because my whole focus was on that. But when I joined my department, out of the 14 maxillofacial trainees of all the 3 years, I was one of the few. So there were 3 or 4 female candidates. And it was a very imbalanced ratio in terms of, and it shouldn't matter really, but it does. Unfortunately, it does matter. It was a very intense training in terms of I had to pick up a new language. It was Western. So I speak Hindi, which is the national language of India, and English, but there are a lot of there are 300
dialects and different
dialects. Yeah. So I got a post in Gujarat, which is a Western Indian state, and they speak Gujarati. And if you want to talk to a villager who's just been hit in a road traffic accident, you can't expect them to answer your questions in Hindi or English. So they would give their history in Gujarati. So I picked up a language in 3 months, literally. Enough to be able to, ask them, take a decent history. But if you want to assess the scale of the cases we would get 5 or 6 road traffic accident, domestic violence, or in general, those kind of cases through the night. They would be prepped early in the morning and then ready to go for theater in the next 2-3 days. And we had 3 to 4 sessions a week of full theaters. Trauma, TMJ, pathologies were left, right, and center, osteomyelitis. And the good thing, I think this is a good thing in Indian max-fax training, is all the major government hospitals for training are associated in the same campus with the medical hospitals.
Yeah.
So I didn't do a medical training, and that's not compulsory in max-fax in India. But I had a year of rotation in medicine while I was doing on call for my max-fax. And because I was a surgical registrar, and the arrangement with medicine, surgery, opthal, ENT, and onc was that any max-fax trainee from our department would need that intense training. I had a lot of support from those fraternities. So, in surgical posting, I was assisting with appendicectomies and lap choles and all those kind of things.
Full exposure, yeah.
Yeah, full exposure. And oncology, we had one full head neck hospital in the same campus, and they were always needing extra pair of hands. So they were eager to teach, and we were eager to learn. So it was pretty, rapid.
Yeah.
Tracheostomies and radical neck dissections and all of those. So it was good, but very intense, and you had to learn quickly, too quick kind of stuff. But I enjoyed most of it. I would have preferred a more balanced. I don't remember the 3-4 years. How did they go? How quick I was? I don't think I ever paid attention to my diet, my lifestyle, and I think that part of training has changed in India as well, and here as well. And I appreciate it, and I think that's for good, because there's a chance that if you don't swim, you'll sink, and burnout rates are quite high. And at the end of my training, I was really exhausted. Quite exhausted physically and mentally, because there would be days of not sleeping, non-stop. Yeah, not sleeping, and forget getting married or having kids. I don't think, it's not gender specific. I think none of the trainees got married in their training. And it's it's unreal. It's not practical. You are in your mid to late 20s. You should, think of those things as well. There's life beside your training and career, but unfortunately surgical branches are a bit like that. Yeah.
Yes, it's tough to balance this training and the lifestyle factors of it. And I think that's pretty, I guess, universal. It would be the same in Australia and the same in North America.
I think so. Surgical branches are a little bit more taxing in that sense.
Definitely. And so you came over to Australia, you got your license and have been working. Tell us a little bit, I guess, about your current state of practice. I know you split time between the dental hospital and doing some private work.
Yes.
So what excites you in your weekly work nowadays?
Look, I mean, 12 years ago when we came here, I came with a very open mind. I wasn't sure. I knew that Australia needed a medical degree, but I wasn't sure whether my experience would count. When I spoke with the college at that point in time, they said, "Oh, look, you've done stuff, but either you sit the AMCs or do a medical degree, and then we can look at your training and see whether we can, forego a part of your training and admit you in advanced surgical training if you're good." But I wasn't really keen at that point in time because basically we had come here for my husband's fellowship in intensive care, and the plan at the time was to go back. So I thought if he finishes his training in 4 years or 5 years and then I'm still doing medicine and then I go back, doesn't really make sense. So we just persisted with doing my basic dental council exams, which were really tough to crack.
Yeah.
Because crown preps and amalgams, I don't think I had done any in years. But we managed to do it. And then luckily, I got a job at the dental hospital in oral surgery. And I was sort of feeling good about it because I could start doing work. I hadn't done much in 1.5, 2 years while I was sitting the exams. And then I got a specialist registration as oral surgeon, and mixed feelings at the time. I thought, oh, this sort of puts an end to any, chance I may have had of doing anything advanced. But at the same time, I was at that point in my life where I thought, look, I do want more from my life rather than just surgery, which it had been in the last decade or so. So it was a good balance. I was starting my family as well. And I think since then, I've been pretty much at peace with what I'm doing here, which is mainly dental alveolar. And that thing hasn't changed. The fact that I love teaching and, knowing more, and teaching is a way of, learning.
Staying sharp,
yeah, staying sharp. So that really keeps me going, and that really gives me a little bit of buzz on my day-to-day sort of practice in oral surgery.
Definitely. And it comes across, I think, we have a pretty good team at the hospital, and we have a lot of good teachers and mentors, and definitely no exception where when we work together, we learn a lot, and definitely challenge us a bit, but I think it's good. It keeps us, like you said, it keeps us sharp and make sure we don't build any bad habits and things like that, which is really appreciated. And one of the perks of the job, really, to work so closely with you guys. One of the main things I wanted to chat with you today, because I know it's a topic that you've written about, and we're actually involved in the policymaking meetings. As clinicians in the hospital, I guess we're kind of like frontline in the way. We didn't have much say in what happened in the back, but we got to see the implementation of systems. And for me, it was really cool because obviously growing pains as the COVID pandemic came, and the hospital had to kind of act quick like the rest of the world, really, to see how we're going to implement all these things. And while like not everything went smoothly, maybe at the start, it was really cool for me to see like the evolution of how these systems kind of evolved, and mostly like the triage thing that we did with patients coming in, and from one person at reception to having chairs and lights, and it was just cool to see that progress. So from, I guess, more of maybe the admin side of things, where you're involved in these things and you have to take in all these external policies and mandates and things coming in. What's been like the last few months like for you, and in terms of work, in terms of decision making, and all those things that are related to COVID and the public dental hospital?
It's been very challenging, to say the least, but also interesting. And I think I think over the last few years, we've had a very comfortable, cozy life, and you can get into that quiescent phase where you don't challenge your brain to learn something new. And I think that was what I realized, that how quickly in the last 3 months I had to really rapidly do something. It almost pretty much reminded of my time as a Max Fax registrar in India, where you're constantly, read an article on something new which you are going to do tomorrow and do it. And that's how I perceive this pandemic as. And obviously, I mean, with great power comes great responsibility. So you suddenly realize that whatever decision you'll be making will be impacting whole lot of people, including your patients and your colleagues and everyone else. So and there's not a lot of data at the time available or research available to back what you are thinking in terms of this something, new virus or new disease, which at that point in time, we didn't really know much about. And even now, there are a lot of unanswered questions. So it was hectic, but I think what really helped was, and I always look back at any adverse experience you've had in life to build your resources that, help you later on in facing any adversities. And I've been through dengue, I've been through malaria, I've experienced both of those outbreaks. Personally, I've experienced them personally and in the community at large. And also riots and, a whole lot of communal riots, earthquakes from where I come from. So this was more like a, emergency mode. Yes, put your gear on and just start acting. And that's what I think we did. And luckily, I've got my husband who's an intensive care specialist. So he was a great source of information about the actual, disease and protocols. And I sort of filtered them down to what we can do in our setting. And we had a good team of people who were able to, brainstorm some ideas and implement some of them. So while, yes, ADA was catching up and they started sending out some good material, but to implement that in a hospital setting was a little bit challenging, but we were able to do it. And I think now the thing is we have to undo some of those things. And that's again going to be a little bit of challenge.
For sure.
In terms of PPE and in terms of logistics, in terms of what patient to see and what not to see. And also the fact that there wasn't much about transmissibility of that of the disease in terms of oral surgical procedures. So while clear-cut established, evidence about aerosols, but then do oral surgical procedures produce aerosols, and those kind of debates and robust discussions needed to be had with people. And every hospital, I'm sure, has the same, there are two tiers where there's clinical side of the thing, and then there is a managerial side of the thing. And often they have to work hand in hand, but then you have to explain where you're coming from, but at the same time, you have to think about what impact it's going to have long term on the economy side of the thing. So yeah, it was a tightrope walking, but I think we did pretty well as an organization and as a department. And there's a lot to be done, and I'm sure we'll look back and think that we could have done a lot of things differently. But at that point in time, we did what best we could.
No, it was fascinating. I think, I guess in a way being involved, and in a way just being on the sideline, just kind of observing what's happening, because there was a combination of, like being evidence-based, which, that was, I guess, more of your role in things of coming of how should we tackle this with some evidence of what other hospitals are implementing and things. And then you said the managerial side of like the clinicians having their agendas and policies and things that they have to kind of follow with those pressures. And then the debates were interesting, like the ethical stuff, like, should we use the PPE to treat patients versus should we refer them off to tertiary hospitals? Are we doing a favor to the tertiary hospitals by treating patients here to like lower the burden on them, but then we're using the PPE? So it was actually really cool just to see all these moving parts and see how things kind of shook out. And as we got into it, like the wait list, like some patients, do we see them? Do we put them back on the wait list? It was really, really interesting. So what's some of the takeaways? Like, I know, the article that you wrote was the initial restrictions of not being able to treat patients. So we're relying on, medication, antibiotics, and just symptom relief. What's your main takeaways from this, I guess, pandemic clinically, and what you think we could maybe do better next time or improve on?
I think preparation is the key to dealing with any kind of emergency. And I think Australia as a country, because we are so, in general, we have a lot of things in our favor. Australia is an island, the population is not as dense as countries like India or China. It's a developed country. All of those things, but the pitfall with that is there's a chance of being complacent, and I think we were in that comfortable mode. We have been for a while, and therefore we developed to a stage, but then we didn't really think that this actually something like this can strike us. And I think we caught up pretty quickly, but our preparation wasn't great. So if you look at from any particular unit, like a private practice, did we have PPE? No, we had no PPE. We had the normal PPE, but then we did not know what kind of mouthwash would come in handy for these patients, or what kind of disinfectants should we use, what kind of guidelines are needed. So those things, I think, really were an eye-opener. And the takeaway is what I think I was about to, so myself and a few colleagues, we wrote a sort of a perspective, and we submitted it to a few journals as well, was there needs to be a core task force or a committee, a disaster management committee, like every country has, like India has, and China. These major economies of the world, they need it. In the same way, every hospital needs one. And there needs to be representation from the key stakeholders and, people who are able to contribute to decision-making, both in operational as well as implementational and research point of view. And evidence-based research should be the agenda of that committee, so that they are prepared if any kind of emergency, whether it's a natural disaster or a pandemic like this, strikes. Because what I found challenging was, getting people on board and getting the right people on board and cohesive, unit. Because if you are fragmented, then the decision making is delayed and fragmented. And that's what was happening everywhere. And there was this underlying tension, and that, that mars your decision-making ability. And it transcends down to, the junior staff and to the clinical and non-clinical staff. And eventually you don't offer the best care. And in healthcare, there should be minimum leeway for compromised care, because that's our duty of care. We have to offer the best possible treatment we can to the patients. We are not selling anything here. We are actually offering health care to a live human being. So it should be the best possible care we can offer. So that's what I felt, that we need something like that in every hospital, and that should be in communication with other emergency, task force or committees with other hospitals, so that a statewide response can be launched in situations like this.
Yeah, that's some great points. And I think you were saying it was a few, like maybe earlier in the week, there's a great point of when we have senior clinicians, like I guess at the government level, who also have different perspectives. Like you're saying, if they're not cohesive in their message, it's so easy for things to delay or get jumbled up, or different, like wrong outcomes to come of it. And it's fascinating, like, if we're relying on being evidence-based, that there's still so much variability of different opinions that people can come up with based on like what's available in the research. It's going to be cool. I think there's a lot of good research that can come out of this, and hopefully we'll towards the end of the year, once we've kind of had a good resolution and a bit of an outcome, so we can actually have a bit of an endpoint to kind of reflect on. I think we can really come up with a lot of interesting stuff that can hopefully be handy in the future if anything like this kind of similar happens.
Yeah, I think because if you look at the last pandemic we had, Spanish flu, I mean, yes, there are life lessons from it, but they can't be applied to the current scenario and the state of world that we are in at the moment in terms of technology and everything else. We are so advanced and different to what the society was then. So yes, I think definitely we need to boil it down to some key points and work at it as a work in progress.
Definitely. The next thing I want to, I guess, ask you is, I mean, you've been at the teaching role for a long time, and you've seen obviously different classes and cohorts of students and things go through different learning curves, different initial abilities, I guess, confidence. I was interviewing a doctor who's a consultant dentist at a cancer hospital in Toronto, Princess Margaret Hospital. And on the side, she does some coaching and talks on like imposter phenomenon, imposter syndrome, and those kind of things. So I'm curious, you've seen a lot of residents come through, registrars come through, even young consultants. What's sort of been like similar trends that you've seen in terms of how people cope with the initial learning curve of increased responsibility or going out on their own a little bit? Just like the teaching side of things, I'm curious, like, what's your take on like a normal arc for like maybe like a resident, for example, just a bit more relevant for me, I guess, and any younger dentists kind of listening, and that growth curve that they have. Any things that you've picked up on or any trends?
Yeah, heaps. And I actually do the safety and quality audit for my department as well. So it's always interesting how we have a higher incident rate of certain incidents at the beginning of, when new registrars and new residents start. And then they plateau and then they start to decrease by the end of their rotation. And what does it say? It just proves the point that everyone's new in experience when they start. They pick up on their skills as things progress and then they become better at it. So it never ceases to amaze me how quickly people pick up if they are driven. And I can't say really if there has been any year or any particular batch of residents who haven't progressed as well as others. Everyone ultimately by the end of their rotation here are, they have really good basic dental viewer skills. And we take pride in the fact that we are able to help residents, and it's a fairly competitive selection, that when people, apply for this position. I think most of the dentists or people who apply, they have a clear pathway or at least some idea of where they are going, or at least they want to experiment and see whether surgery is for them. So this is a pretty safe environment in that sense. And when people start, I always tell them that this is the safest place where you can make mistakes and learn from it. But I do feel that it takes a while, at least 3 to 4 months, for people to actually get rid of their older habits and inhibitions. And that whole initial thing to prove that I actually know things can be a bit counterproductive in the learning. And I look at it like, I think things have dramatically changed for me after I became a mom, because I could see when I look at my son, and if I'm trying to teach him something, the older he gets, he becomes more and more resistant to, for me to trying to prove that the way he's doing a particular thing is wrong. And he's always trying to come up with a reason why he's doing it, even before he's analyzed that it's wrong. And I see it in the same way that my job is to actually make sure that whatever I know best, I'm able to impart it in the best way possible to whoever is coming in my path of teaching. And it's interesting to see that most of the residents, they start with that initial, a bit of resistance, older habits, trying to prove that, yep, I can pull out a wisdom tooth in this much time. I think by the end of their rotation, they don't really actually think, and which is great. We've been able to achieve our purpose, that it's not about the time. It's actually about the quality of stuff you offer. And once you work on that, automatically your efficiency and economy of time would come. So yeah, it's an interesting journey. And then when the residents train to get into the Max Fax training or surgical training, and then they come back as consultants, that's even better. So yeah.
No, that's great. And I think that definitely, I worked in private for a few years before taking this job. So, you go from complete, clinical autonomy, you're kind of just doing things as you want, without any, there's no one saying, like, not that people say no to things, but you don't have to like bounce ideas off people or like run things past people. So it's an interesting like experience to come at the first few weeks, and you're going from being your own, like, unit to back to like, okay, now it's a bit humbling, I guess. And my confidence, like, it's like the Dunning-Kruger effect of, you don't know what you don't know. And so now I'm like way less confident because I know, like, I've seen the range of things that can go wrong, or the challenges and just things that I'd never even like thought about working up or considering before doing things. So it's almost like a miracle I've got through the past few years without too many
But I think we also feel really good in the fact that we are able to offer such a diverse experience to the residents. Like if you look at our consultant base, we are all from different backgrounds, trainings. Some of us are from overseas, some of them from New Zealand, and some from Australia, and dually qualified, singly qualified. And all of us have our different, little tricks of the trade. So I think that's a really good advantage for a new resident starting on, because they have a vista of things to choose from or reject, and then ultimately derive their own concoction of things that they'll use and later on in their life. So I think it's a pretty robust and good training in terms of residency. And even with basic dental alveolar skills, I think this is the bread and butter for even maxillofacial training. So dental alveolar is the base for any other advanced training you may undertake later on.
For sure. And for the young dentists listening, it'd be interesting to get your perspective and advice on this. We're chatting about this actually yesterday over lunch. Obviously, if you get through your dental degree, like there's some baseline, knowledge that we all have, ability that we all have. But what, like from your take on it, what's key personality traits or like habits and stuff that you've seen of like people who've successfully made through these programs and are doing well, regardless of if it's like in oral surgery or if they've gone into branch into other things, beyond that baseline ability that hopefully we all have. What are those key traits and habits and things that you've kind of noticed?
I think if you look at any specialty, any profession in life, not only just dentistry, people who are successful or who have been successful does not necessarily mean that they've got 20 degrees behind them. I think there are certain personality traits and also what you measure success as, whether you own 10 different clinics and you can still be a very unhappy person, or you can work in a public hospital for whole of your life and yet be the most happiest person in your fraternity. I think what really determines is what you aim to achieve by your profession. And if personal growth and increase in your knowledge and skills is what you are looking at every step, then you'll keep the excitement alive, because most people burn out either by boredom or repetition. And for young dentists or who wants to really persevere in this branch, the tips I can really share is, one, find a niche area, whether it's general dentistry, but find an area that really challenges you and stimulates you, and make it your own niche. And that way you will be interested and other people will be interested in what you're doing. So there are a lot of general dentists who do everything, but at the same time, they have a particular focus, either it's in kids or, a particular area of dentistry. And if you are specializing, specialist training itself is quite grueling in any field, whether it's max fax or endodontics or ortho. It's the same rigorous cycle. I personally feel that you need to have varied interest in life, so that dentistry or your specialty is not the only thing. And that sort of gives you a good balance to sort of unwind and unhinge from the, tedious, repetitious process, which unfortunately dentistry is. A lot of people find, they get bored after their 40s or 50s. They are burnt out after doing the same thing again and again and again. So I think it's important to have a life outside your main career. Yes, you've spent 10, 11, 20 years, striving for something. But at the same time, life is more than that, and it should be.
Yeah, that's great. I definitely agree with that. And I think it's something that I think it's a nice natural segue into, the journaling and the writing and stuff that you're interested in. And I think that's something that maybe we kind of connect over, because we're into this type of, it's creativity is a nice outlet, I find. And it's a nice creative outlet. Two, what you're writing about and what I'm trying to podcast about is there's a nice satisfaction of, we're kind of contributing back to the professional in a way. We're contributing to the public, sharing knowledge. And for me personally, like the legacy component is super cool for me, because I know like when I look back, even if nothing comes out of all these, like when I'm like 50, I can look back and be like, I have like 100 hours or whatever of recorded interviews with different dentists, and I wonder what so-and-so is doing now and things like that. So there's a certain beauty to it. And I always have this internal debate of, work versus hobbies. And it's tough because at a certain point you need to turn that knob one way or the other, because you don't become a specialist by accident, or you don't become successful in your career by accident. It does take that time and dedication to do it. And it might, like you said earlier, come at the sacrifice of some of these other things for a period of time. But I think the retrospection that you have is cool, because you can say, well, you can do that for 10 years and then come back to it. It's not like it's now or never. So tell me a little bit about your hobbies in terms of writing, the topics that you enjoy writing about, and sort of what you've done for someone who hasn't listened. And I'll put the links to the ones you've already published in ABC and others, and sort of what you hope to do in the next few years with that.
Sure. I think the more I think about it, and the more I learn from my own experience, I actually want to talk more about this whole thing of balancing and having a life outside your main career or profession. And for some people it could be sports or some creative pursuits like painting or writing, but do not underestimate the value of it. It's basically, actually, it feeds into your main career, and that's what my experience has been. I've definitely become a better clinician after I did my journalism, and not because I could write cool stories, but it's because it has made me understand and think outside the box in terms of talking to my own patients. And I was actually writing this personal piece for one of the magazines, and the skills that I learned as a journalist, interviewing and listening to people and paying attention to detail, that actually helped me so much as a practitioner, when I'm taking history. And at the same time, my profession as a healthcare worker has helped me write stories about, topics that normally general public does not really understand or pay attention to. For example, I wrote a piece on mental health of healthcare workers, and you won't believe, like, I got emails from a lot of overseas practitioners. I'm not sure how it reached them, and it struck a chord with them. It was set in Australian sort of scenario, but the common themes that emerged were burnout, and how healthcare workers are sort of expected to have this cloak of resiliency, and why we need to change the culture in healthcare profession. So I think having a life other than your main profession is an investment you make into your main profession. And also, not necessarily monetary benefit is the reward, but what you gain in terms of your mental health and well-being is far more valuable long-term than your actual career or profession. And that's my advice to anyone who is starting out, that think big and try to parachute out of that whole, work culture where you're completely embroiled in it and you feel frustrated and burned out, and, the politics is dragging you down, or the culture in your workplace is dragging you down. Try to parachute out and see if there is anything else that interests you and divert your time. So I look forward to my monthly writing group sessions. And when I go there, I'm not a surgeon. I'm just a writer who's trying to learn how to not make grammatical errors, and it's so refreshing, because I'm not judging myself, and I'm not being judged in the same parameters that I exist at the dental hospital. And it's refreshing. It's refreshing, exactly. So I think it's a kind of a detox, and people should find ways to stimulate their endorphins and something that brings them joy and that they can look forward to, so that they are able to contribute more to their main profession.
Yeah, no, I think that's a great perspective. And, from these interviews, I often get like one or two things that it's like a little like flashbulb, I guess, moment. I think that the linking back of skills and things that you learn from your hobby back into the day job, that's pretty cool. I hadn't really thought about it from that perspective, because you develop all these things and they become second nature in the background, and then you kind of naturally do them at work, and you're like, oh, that's a great perspective that you had. So what do you want? Do you want to keep writing? Do you have like maybe a book or something that you want to write about, or any like long-term big goals with the writing? Or is it just kind of take it as it goes?
So, Omid, just imagine that I am the resident in writing world at this stage. So I need to still hone down my skills before I write a book. initially I was quite resistant to writing health-related stories because I used to feel quite strongly that I need a break from health, and that's why I don't want to write about science and health and medicine. But I've gotten over that obstacle, that barrier in my mind, because the few health-related stories that I have written, I've had such good feedback from the readers that I felt that, probably I owe it to, people to simplify the medical jargon and, simplify certain health related topics. And I might have a dual perspective from a journalist as well as a healthcare worker. So yes, some of those projects that I'm working on at the moment are health related topics, but I'm also working on some academic research papers. Recently, I've been given a clinical honorary fellowship at the uni, and I feel more now encouraged to write more and research more. And I think at this stage of my career, I'm not saying I've done it all, but I've done more than, I've done most of the stuff that I would like to do. So I want to now take a step back and learn more in terms of research and be able to contribute more to the dental surgical fraternity.
Yeah, that's awesome. And I think it's great to keep evolving and keep growing so you don't get stale. Exactly. Like you said, you don't get that burnout because there's like always new challenges and things. And yeah, I think I definitely in private practice, I was kind of getting that staleness. And I think that's why I was really kind of keen on changing it up and getting this job. I haven't felt this, like, I guess, invigorated in a long time in terms of like just being challenged daily. Like you come to work and you don't know something and you get grilled and you have to go home and like search it. I guess it's kind of like in a way like being back in school in that environment and just being around people, because like dentistry, especially private dentistry, is very isolating in nature as well. So it does get to you when you're just by yourself and you don't have people around you for.
Yeah, and that's one thing actually I forgot. I wanted to say that for people who can do it, they should always do 1 day of public service if they can, and it's not because you should contribute to the society. You should. It's a great way to be able to give back to the community, but also it makes you appreciate both the sides of the coin and the challenges you face in a public setting. They help you so much in terms of your private practice. And this is a very practical thing to say. I went into private practice after a long time of public service. So even in India, I was in public. And then when I came here, I was in public for 10 years. And then I opened up my own clinic with Warren. And I just realized that the reason why I'm enjoying my private practice so much is having worked in the public sector for 10 years, it has given me so many skills in terms of patience and resilience and, variation and complexity of cases, that the certain cohort of patients that do trickle, challenging ones in the private practice, I feel I'm better equipped in my skills to, tackle them. And I think every clinician should be able to, they should contribute 1 day of their normal practice to public if they can.
Yeah, definitely. Especially in a large setting like the hospital, just like the actual social interactions with different clinicians and stuff has been amazing as well. And seeing the different specialists, and it's just a little bit more vibrant. I really enjoy the hospital setting. I think it's one of my biggest draws to these types of roles. So that's great. Well, it was a lot. We covered a lot there. Is there anything you want to chat about or talk about that we haven't talked about yet?
I think you've covered it all, and you should consider an alternative profession in journalism. Obed, you're a good interviewer.
Thanks. No, I enjoy it, and I mean, there's the art to it as well. And I want to, like speaking and being elaborate with your thought is not easy, and it takes time to develop that. And writing is something that I really enjoy doing as well. Mostly just like for myself, I journal and things. And I think writing things down really helps with like articulation of thought, because you really think through things, which you might not do otherwise. So taking the time to do that is really cool. And so thanks so much for coming on. It was really cool to get your perspective, your history, how the COVID pandemic came and went, and how we maybe it's not gone yet, but hopefully the impact of that at the hospital. And I mean, it it's not great that we missed out on so much clinical experience maybe over the past few months, but just being involved and in the action, I guess, for the past few months has been really cool. And I think something that none of us will really forget. Like, for the
exactly. And 20 years later, when maybe, hopefully not, but if you're in a different pandemic or a different crisis situation, you will look back and you'll think, oh, I've been through something similar, and it's fine. I can go through it and it'll be over and I'll be fine.
You can get through it again. Krati, thank you so much for coming on. And hopefully we'll chat soon, and we'll look forward to more papers and
pleasure. All the best, Omid. Cheers.
Thank you for tuning in for another episode of the Noobie Dentist Podcast. Please be sure to subscribe and head over to iTunes and give the show a 5-star rating. For all show notes and to access all previous episodes, head over to www.noobiedentist.com. Have a great day.